It was never meant to be for the people who lost the person. Because think about it. People don't really have a problem with accepting someone died. They know they died.
Today on the show is Valerie Smith. She is a licensed grief and trauma therapist who also specializes in induced after death communication. What does all that mean? I have no idea, but we're going to find out together. So without any further delay, here's Valerie Smith.
Hello, everyone. Shane, thank you so much for allowing me on the show. I know he introduced me already, but I am Valerie Smith. I am a licensed clinical social worker and a certified forest therapy guide. I am also the owner and director of a practice in New York called Sugar Maple Counseling and Ecotherapy, where I provide primarily bereavement services and complex trauma treatment. And I am also a supervisor to a wonderful group of interns. So, yeah, Shane, thank you for allowing me on the show today. And I am happy to answer anything you have any questions about.
Yeah, no, I'm glad to have you on. I appreciate you coming on. I know that you're a very busy person, so let's just get right into it. So basically, trauma and a grief therapist. Why don't you just tell us what that is and what you do in that role?
So I work with people mainly who are navigating complicated grief. It's people who are having grief where it seems like they are not progressing through it the way they should be, whatever that means. They tend to be very, very stuck on something, usually the sadness in specific associated with the grief, but also the other effects of that, such as how it changes their relationship. It can change their sense of self. It changes their other relationships and so forth. I also specialize in developmental trauma, which is also known as complex post-traumatic stress disorder, as in the trauma that affects us in our formative years. Usually for this, it is people who have experienced a lot of emotional neglect, but there can be other examples. And I also work with people who are experiencing major life transitions, such as new parenthood, loss of a parent, and so on. My work blends evidence-based clinical approaches such as eye movement desensitization therapy, also known as EMDR, trauma-focused cognitive behavioral therapy, dialectical behavior therapy, etc., with nature-based practices and a specialty technique, which I will talk more about in a moment, called Induced After Death Communication, also known as IADC. Practically speaking, this means some clients come to see me in person for EMDR, IADC in person, or for some forest therapy type techniques where I am doing healing practices with them outdoors. But most people actually meet with me online because I can do pretty much everything I do in person online, and it's just more convenient for people. And I also do things like group therapy, workshops, and things in person through a partnership I have with a local conservation organization called Hudson Highlands Land Trust, which also includes me wrapping things up with a tea ceremony. It's a very, very beautiful, wholesome type of treatment, which I can get more specific about.
Yeah. Okay. All right. Cool. So, I'm curious, why did you personally choose? Well, let's just go with the most basics. Why did you personally decide to become even a therapist in general? And then ultimately, why did you move into grief and trauma therapy?
Well, the simple answer I like to give people is that I am bad at math, which is the truth. I am bad at math. Therapy does not involve math, except for billing stuff, but that's also what a lot of apps are for these days. I cannot do math. But no, but really the deeper reason is that originally my background's in social work, and originally my major wasn't even social work whatsoever. It was wildlife conservation. But I went to this very small school in Maine called Unity College, which is all environmental sciences. And while I was studying wildlife conservation, my mother passed away from complications of alcoholism. She had cirrhosis. And it kind of just completely derailed me, to tell you the truth. I didn't really have a place to go back to. I ended up living with someone who turned out to be incredibly abusive later. Um, and I had already been coming from a lifetime of a lot of pain. I grew up in a very violent household. My father was a violent person. Um, And my mother, due to her alcoholism, was just very emotionally negligent. Anyways, so they both actually ended up passing away when I was a young adult. And after losing both of my parents as a young adult, I realized how little space our culture gives to grief in general. I became a therapist to change that, to help others find peace and loss, and to really normalize the grief experience. What I noticed in specific with me was that there was this huge lack of services available. You know, when you're a young adult and you lose a parent, it's a very strange time because your peers do not relate. They do not get what it's like. They at best think like, yeah, I guess I kind of get it. I lost like my grandmother, but that's not the same thing. And the other thing that makes it difficult is that you don't really have the services accessible to, say, children and teenagers who lose a parent. You're just essentially really on your own. And in young adulthood, people are already on that cusp of independence, but all that just gets ripped out from under you. So a lot of it isn't so much about just grieving the loss of the parent. It's about grieving this loss of identity and what that means during that time in their life and the effects it has, such as their sense of the world, how they're relating to others, and even those things that people just don't really think about, like a college commencement, and that by default someone's parents would just be there, those kinds of things. So because I really wasn't finding these services, and the best thing I found really was just a general parent loss support group where I was literally the youngest person there by a difference of 30 years with everyone else, I thought, I need to go about this, I need to do something with this, I need to try to find meaning in my experiences rather than just being in despair about it.
Yeah.
Yeah.
Okay. So let's suppose they're watching this and they say, oh, this sounds like it's up my alley. I want to be a therapist. I'd like to help people. First of all, what would be the easiest way what's the fastest path to become a therapist? Like what's the path they take? Does that person deal also with grief, or do you need the special certifications that you ended up getting in order to even process or do that properly? And then ultimately, I guess, if they wanted to do exactly what you do, how would they get there?
Becoming a therapist is a very long process. And I think a lot of people don't realize that because at first they're just thinking by default, you know, in my group of friends, I'm the one who likes to give advice. First of all, therapists don't give advice. We're not supposed to. We're supposed to guide people towards making that advice within themselves. However, to actually answer your question, Shane, so this varies by the jurisdiction. I can really only speak for New York. So in New York, you need a master's in social work or mental health counseling. Then you need supervised clinical hours and then licenses and specialized trainings. To answer your question, the cheapest way to go about this would be going through a state university MSW or MHC program and then adding the trainings postgraduate over time. The reason being that a lot of the stuff you learn in the foundation years in graduate school carries over anyway. And if you go for a certain certification as a graduate student, it really might not actually count because you do have to be considered a therapist already to do it. I'm not going to speak about MHCs because I'm a social worker, but I'll at least answer the pathway to become a licensed clinical social worker for you, and then the other things I did. So, like I said, first you have to earn a Master of Social Work degree from a social work accredited program. So, when you do this, there's two different ways to go about it. You can do what's called advanced standing, which is where you earn a BSW or a Bachelor of Social Work, which means you slice off 2 years from the master's program, or you can do a 4-year program. Mine was the advanced standing, so I got through graduate school much quicker. Uh, while you're in graduate school, there is a mandatory field placement, or it can be several. It can be very, very time consuming. Usually, universities suggest, like, oh, quit your actual job and do this. But I realize that is not reality for most people. In my case, I still had to work full time, I needed to take care of myself. So I was lucky to find a field placement where I really was able to go to my actual full-time job, and then afterwards go straight to the field placement. But that was a grueling year, and while I was doing that, I was gone for a good like 14 hours a day. You then have to apply to take the master's level exam. That is about around like $300 total, I think, if you add in the processing and the fingerprinting and all of that. I don't remember. It was quite a few years ago for me. It's probably gone up. I'm not sure. Then you take this exam, and if you pass, you'll know right then and there. If you do, you are now a licensed master social worker. After that, that means you have to then go on to complete 3,000 hours of supervised clinical experience under a supervisor, which includes 100 hours of direct supervision. So, what I mean by that is at least 100 hours of really meeting with them, discussing cases, doing case consultation. And then there's 3,000 hours of direct practice with people. That 3,000 hours cannot be done right away. It has to be stretched out over 3 years. So even if you go and do these 3,000 hours and it's only a difference of like a month before technically 3 years, New York State is going to say, we don't care. It has not been truly 3 years. I speak that from experience because they break down the math so strategically that I came out to only like a week and a half short of 3 years, and they said, apply again. And I was like, wow, they're very serious. Next is a clinical exam. So then you pass a clinical exam to demonstrate your clinical knowledge. That clinical exam, grand total with the application, the processing, the fingerprinting, is around $500. After all of that, you are finally a licensed clinical social worker. That is the terminal degree and terminal title. There's nothing higher, except if you want to talk about something that's called like the Doctor of Social Work. But that's not really a clinical thing. That's kind of more like an academic route. So it's
Research.
irrelevant to this. Yeah, it's irrelevant to what we're talking about. So to do induced after death communication, first you have to be a certified EMDR therapist. You go to this week-long training. Then you have to do about 10 months of more direct experience and supervision. And the training itself varies. To anyone listening, the cheapest price I've seen is about 900 something, but the average I've seen is more like 2,500. Uh, After you are certified in EMDR, you can then do IADC. IADC is not expensive and it does not take long. IADC is a 2 day long training and it's around like $450 or something. It's just more so getting up to all of that takes forever. As for the forest therapy, that's different. You do not need to be a therapist for that. Forest therapy is actually kind of a misleading term. What they are talking about is a technique that was developed through something called the Association of Nature and Forest Therapy. That is an online program that's 6 months, and plus there's a 3 day long certification. Um, Literally anyone could be a forest therapist as long as they do this certification. It's not just for mental health professionals. But what I really like about it is that it's given me this more holistic view where it allows me to see nature not just as something beneficial that helps us, but also as a partner, as a co therapist. And it just brings in a very spiritual perspective into my work, which I have found has greatly enhanced the process for people I work with. And right now, actually, I am in the process of trying to combine all of my grief work with ecotherapy to make a brand new modality, actually.
Really? Okay, maybe we can get more into that later. I definitely want to explore
Yeah.
the ecotherapy and all that a little further down the line here. But I mean, just to sum up what you're saying, it sounds like this is the kind of career where there's a lot of add-ons, right? So you add
Yeah.
on this, add on this when you
Yeah.
can.
And really, specialization, I would say, is key. There are far too many therapists who really are generalists, and there's nothing wrong with being a generalist. It's just people should know their limits. They should know what they're really good at. And I think if people stay too much in that generalist role, it keeps them from that growing, but it also makes them come across essentially as like a jack of all trades. And that can be detrimental because then you might end up with a client where they have some sort of issue or something where you really do not know how to help them. Or there might be like some true actual bias that the clinician cannot work through. And there's going to be a lot of transference and countertransference there. So I recommend to people as much as possible as a student and in their LMSW years, that's the time to really get a feel for what interests you, what you like, what you don't like. But once you go on to be an LCSW, know what you want to do. It's important.
Okay. Okay. So, I'm curious about the work-life balance for this career. So I guess if you could answer it in two ways, if you're just a licensed clinical therapist, basically what that life balance would probably look like. We're just talking 9 to 5 kind of a thing. I know that it sounds like maybe I'm reading into this, but it sounds like your patients could affect you, and you might take that with you, in a personal life.
Really, what you have to do is learn to protect your energy fiercely. This is a place where it is very easy for your energy to be sapped and for there to be a high risk of the therapist letting out their emotions on the client, which obviously is extremely damaging. I've unfortunately had to work with a number of clients who really were truly harmed by therapists.
Really?
Yeah, just because it's not that the therapist was being cruel or anything of that sort. It's more so the therapist would be hit with something that the client said that really triggered them because they didn't work on themselves. And they would end up breaking down in session or something like that. So, in protecting your energy, I would say the first thing sounds like a cliche, but I think it's absolutely true. Therapists should be in therapy. And if they're not in therapy, they should be asking themselves why they think that they should be giving therapy to others, but why they don't need it. If it's not going to be therapy, I at least think it should be some sort of spiritual practice, maybe going to a pastor or whatever it is. But it's got to be some sort of real deep soul work and not just something like, oh, yeah, I write in a journal. Um, Not to say that journaling is a bad thing. Journaling is a great thing. It's just I think therapists need someone who can actually really challenge them and help them grow. I will say a really nice thing about when you're a practice owner is that you really do get to have your schedule and call your schedule. In the student years, it's not like that. I call that the boot camp years. That really is you're just going to have to do what the school says and what the place where you're getting supervised says. I had a schedule where I wasn't getting home till like 11 at night. It was exhausting. But now I do get to have my own schedule. So with that said, now how I have it is that I am 8 to 4:45. I know people listening are thinking that's incredibly unfair. A lot of people work. They are correct. How I have it designed is that my clients tend to be people who either work from home or are stay at home anyway. And yes, there are people who truly do prefer daytime. As for the people who want evenings, I have associate therapists who do evenings and do weekends. So everything's met. The reason why I have that schedule though is because full disclosure, I do have a toddler and he's in daycare. So when he's home, that's my family time. Family time is sacred. I advise that to everyone. And it's a disservice to him if I'm working while he's home. And it's a disservice to my clients if they hear him because when I'm in therapist mode, I need to be in therapist mode and I can't be disruptive and be like, oh, I'm sorry, my son's having a temper tantrum. I'll be back. No, people are spending their time and money to make sure they're getting care from me, and they deserve that.
Yeah. Excellent. I'm curious about pay for therapists, and you don't have to tell me exactly how much you make because you also have a business side of it. So leaving that out of it, just basically how much do people make as therapists? And this probably also varies by state, but
I know it's
tell us
such a
about New York.
huge question, and it depends on too if you take insurance and then what insurance it is. But the truth is, with insurance, what people get in their statement is not what the therapist gets. Okay, so when they see this bill that says $200, they're thinking, "Oh wow, the therapist just made $200." No, we didn't. Most of that money actually goes back to taxes because most of us are 1099, so we have much higher taxes than most people. Also, it goes into malpractice insurance, subscription software, if we have an office rent. So it's very hard for me to answer that question, but I'll just say to give a true average, early career therapists, it's low. It's probably like $40,000. Mid career, it's more like 70 to 100,000. Some therapists do go on to make a lot more than that. There are some therapists who make like 2,000, 200,000, 300,000. Um, they tend to be ones who have very, very large practices, or they're ones who have really broken out into doing like a lot of like consultations and public speaking and things like that, and just being much more creative with their career.
Okay. Okay. Valerie, who would you say this career is not for or is for? Is there a type of person that comes to mind?
It's not for people who can't separate their client's pain from their own, and for people who want it easy, and for people who have not worked on themselves. I say that because the average person doesn't wake up and say, I want to be a therapist. They want to be a therapist because they've gone through something of a huge magnitude and they're trying to make meaning of that. And that's a good thing. I think it's good to find meaning in things. The problem, though, is that there are people who have not really worked on themselves and they think that going through something makes them qualified, when really what it actually means is that you have to be especially sensitive and attuned to that, because you might get very, very triggered in the process. So I can give an example of that. Um, I'll talk about my own life. So as I disclosed earlier, I lost my parent. I can work with that all day. I can work with cancer all day. I lost my dad to cancer. I was his caregiver. I can still work with that all day. What I cannot work with is someone who has substance abuse as their primary diagnosis. Now, by that, what I mean is if someone is drinking here and there, I can deal with that. But if it's to the point where someone's life has been completely incapacitated by substance use, I am not the person for them. And I think this kind of awareness is key. So, to be honest with everyone listening, I don't really tend to take clients like that because I know I can't help them and I know I'd end up hurting them. I end up having a nice network of referrals who I can refer them to, therapists who I know are good for them. It's just my sensitive spot. Every therapist has one.
Sure. If you could change anything about being a therapist, about the career, is there anything to come to mind?
I mean, I wish it was more accessible. The system burns out good therapists before they even get established. Very long hours working up to that, extremely low pay at first, where people truly are struggling to be able to pay their bills. And it's a struggle for clients. We see a lot of people who really do need some sort of specialized care or something, and insurance doesn't cover it, or they really need someone's help, but they're on like some sort of insurance where, to be honest with you, the reimbursement is so low that it would all just go back to taxes essentially anyway, and what would be able to be kept would come out to about minimum wage. There's a lot of problems in the system itself, but as far as the profession and like the heart of therapy, I wouldn't change that.
So I'm curious. Hopefully the answer is no. But if someone's in therapy with you and insurance has said, okay, you can treat this patient, is is there anything you can't talk to them about or help them with because the insurance says, well, you can't help them with this, but you can help them with this, and you end up in these weird
Yeah.
situations with a
No, it's happened
client?
to me. It's happened to me. IADC is still one that's considered in development. So when I'm working with people who are grieving, they have a few options. One of them is that they can do some EMDR with me if they want, if that's covered. Otherwise, we can go about their grief through rituals, narrative journaling, a lot of cognitive processing, those kinds of things where insurance companies will not have a problem with it. IADC, though, none of them cover it. So when it comes to that, I tell people, you know what, we have to make a very serious decision here. If you want to do IADC, this is the price. If you're having a financial barrier, I will do my best to honor that and work with you so we can figure something out. Or it means, unfortunately, you can't get the treatment. And that's just because it's not me, it's the insurance companies. If I do it, there's a risk of a clawback or them just completely denying the claim.
Okay. Um, would you be willing to share possibly one of the worst days you've had as a therapist, or maybe even one of the best days?
A best day is really just watching someone reconnect with joy or something after years of numbness and pain, and seeing that they've made so much growth. A worst is losing a client unexpectedly and I don't know why. So by that, I don't mean like suicide. That's not what I mean. That's fortunately never happened to me, but I actually do know therapists where they have lost clients to suicide. I mean where it seems like the relationship is going well, things are going well, and all of a sudden they just ghost me and I truly do not know why. I think a lot of it happens where people are afraid of upsetting the therapist. They want to please them and they think it's easier just to pull away and say nothing. But what I can say to anyone listening is that your therapist wants the feedback. They can't grow unless you let them know. And if you don't feel it's a right fit or whatever it is, really just let us know. We would rather have an answer than not hear anything. And even more importantly, at least we will know that you really are okay. It's okay. You can just send a text and just say, I really don't think this is working out or whatever it is. We're not going to take offense to that. We're not here to be your friends anyway. We're here to guide you and work with you. We can take that feedback.
So let's say tomorrow you found out you won the lottery, up to $500 million. Would you still do this job?
$500 million's a lot of money, you know.
It's a lot of money.
No, I wouldn't.
All right. I wouldn't be doing any job myself either. So
Yeah, no, honestly, I would just I'd probably open like an animal sanctuary or something like that, and just yeah, it's really probably what I would do.
yeah. Okay.
Yeah.
All right. Let's get into IADC. Let's talk about what is it? What does it look like? How does it work? Just give
I
it all to
love
us.
IADC. Love IADC. Um, IADC stands for Induced After Death Communication. It was developed by a psychologist named Dr. Alan Botkin, who was doing a modified version of EMDR back in the 90s at a VA hospital in Chicago. He modified how EMDR typically goes, and through this modification, he noticed two profound things. One, by working specifically on targeting the sadness associated with grief, not the anger, the confusion, the guilt, all that other stuff, just the sadness itself, it allowed his clients to have this profound cathartic release where they really felt like for the first time they could actually let go of the sadness that they've been carrying from the loss. Um, it proved way more effective than like a whole year of traditional grief counseling. And the reason is because in this part I can say in EMDR, there are a lot of protocols set up to let people take a step back and like essentially like abort the process if needed. With EMDR, it's not like that. You're there and you're told you're safe, but you got to let yourself feel this. You got to let yourself cry and just let it out. So that's what happened. And they'd actually end up having this cathartic release. So then what happened that he noticed that was even more astounding, and thus the name Induced After Death Communication, is that in 90% of his patients, they had an after death communication, which is a perception of some sort of extra sensory phenomenon, essentially. For them, they, first of all, in ADC, an after death communication always has to feel peaceful. If it doesn't, it's not an ADC. So after these people have this cathartic release from the sadness, it ends up making them feel much more serene and calm inside, which makes them more prone to this. They had these beautiful experiences where they really felt they were having a reconnection with this loved one. It could be visual, it could be tactile, it could even just be like they're sensing a message from them. If it's visual, which when I've done it with people, it tends to be, when they close their eyes, they tend to see this beautiful array of color. They can see a tunnel. Tunnels are very common for some reason. Their loved one walking through a mist, a beautiful landscape where they see their loved one, but always a sense of peacefulness. So, what's going on here to break down the science is that EMDR therapies in general have us work on that state of mind where we are processing while awake. It is the same exact thing essentially as REM sleep, except we're awake and we're completely alert and completely in control. But it's activating those same pathways. REM sleep is that time of day where we really are processing everything going on. And in REM, our eyes are going back and forth, back and forth, back and forth. EMDR does the same thing. It does what's called bilateral stimulation. Our eyes are going back and forth, back and forth, back and forth. So that's why that works that way. And as I'm sure you probably heard me say, I said with IADC, it's a perception. The reason why we say perception is because this is a psychotherapy. I can't go claiming that what is happening really is for a fact happening, and that's not even really what matters. What matters is the experience and the meaning to the person undergoing it. In this, I'm just leading them up to that point. They're the ones having the experience. I'm not telling them what's happening. I'm simply just saying, "What do you notice? What do you feel? Tell me more about that. Tell me more about this vision you're having." So I'm not pretending to be like a medium where I'm like, "Oh, your grandmother's talking to me right now." No, it's nothing like that.
Right. Right. You're letting them tell you.
Yes.
Have you experienced any type of after death communication in your life?
Yes, I had after death communication with my mom. When my father was in his final days, my father was in home hospice, but in his very final days, he had to actually be in a hospice inn because his condition was so severe that he can no longer do home-based care. And I was in what they call the reflection room, and all of a sudden there was this golden light that came through the window. It wasn't the sun, though. I don't really know how to explain it. And I felt it come over me, and I just felt this very warm, loving presence, and it was my mother. And I didn't hear her talk to me, but I felt like she was saying, "You've done enough, and it's okay. You can let go now. I'll take him from here." I also had an after death communication when I was in Wounded Knee, South Dakota. A few years ago, I did a volunteer trip through an organization called Remember, which is it's an organization based in Pine Ridge Reservation in South Dakota, where we do community work like skirting trailers, delivering bunk beds to children, things like that. Anyways, so for part of this, we went to Wounded Knee to get more of a cultural and historical immersion into what happened there. And while I was there was a guide that was explaining to me and the rest of the group the massacre at Wounded Knee. To people who are listening and who might not have heard of this, definitely Google it. But essentially, what had happened is that um, about like 300 Lakota people were massacred by the cavalry, and they were buried in a mass grave, and it's called Wounded Knee.
Yeah.
So
There's a really good book, Bury
yes,
My Heart at Wounded Knee.
when I was there, and this happened to the whole group actually. Um, the guide got to this particularly dark part of the story, and when this happened, all of a sudden we just felt this cold gust just blow through. But it wasn't like a wind. It felt almost like it was snaking around our bodies and trailing through. And there was no weather explanation. It was a totally still day in May. And there was actually a girl in the group who fainted, and she woke up like 30 seconds later. We all had water with us, so really, unless she had like an underlying heart condition or something, I do not have any explanation as to what happened.
So, correct me if I'm wrong, but it sounds like after death communication, not through IADC, but just in general, it seems more common than not. Like I know that my wife had an experience, and can you from therapy, has that come across multiple times just in regular therapy with
Yeah, yeah.
patients?
I mean, when I open the conversation to really allowing people to get more spiritual, which is something that I think therapy is doing well with, we're starting to get more comfortable with the spiritual conversation. For the longest time, we were told, "Don't go there." It's not like that anymore. But when I allow that and they feel ready to talk about it, yes, I've had clients tell me about ADCs. There's research on this. It actually is a very common phenomenon. It's more so most people just don't talk about it because we don't want to be seen as like delusional or something like that. Which by the way, with IADC, when I have to emphasize, we do have very thorough assessments to rule out psychosis and things like that. So when these experiences happen, it's not psychosis.
Right. You do IADC in New York only, right? You're licensed in New York to do it.
Yeah, I'm
Is
trying to
it
get licensed in Massachusetts and some other states right now, but right now it's just New York.
so if someone became interested in this, is it in all the states now? Is there any places? Okay.
I mean, you know what? Don't quote me. I think so. But it's regardless, and actually it's an international therapy, so people do it in other countries too. It's more so people when they're looking this up would have to make sure it is within their state or whatever, just because the therapist might not be able to see them otherwise.
Okay. And then if you put them through IADC therapy, what's the likelihood that they'll have a result that makes them deal with the grief? I get that helps them deal with the grief. Is it?
It's it's high. In my experience, I want to say it's probably like 95%.
Wow.
That does
That's
not mean all of those people have an ADC. For that, that's about 75%. But I have noticed that of the grief counseling I've done, it seems to be by far the most effective one. And I think the reason is a few. One is because it is this rapid fire EMDR. It is done over two 90-minute sessions over 2 consecutive days. You just get it out there. Um, the other reason too, I think, is because it really truly makes us have to just sit through it and experience it. It's not like talk therapies where you're still not really processing. And most importantly, it uh it honors what we call continuing bonds theory, which is what it sounds like. Continuing bonds theory is the theory that death doesn't end a relationship, it just means the relationship has changed. It normalizes that and allows us to go with that thought of what if I could talk to them again? And I think for so many people, that's what they really want to know, and that's what they want to feel and experience.
okay. Want to move on to ecotherapy?
Yeah, so ecotherapy, in a nutshell, is really just nature-based therapies. There's a lot of them, so if it's okay, I'd like to more so talk about the one I'm developing, just because it's a very, very broad question. So I am currently in the works of making something called ecological embodied grief processing therapy. That is a mouthful, so I'm just going to call it EGP. This is a grief focused model that I'm currently developing that integrates the healing benefits of nature with psychological and spiritual processing. It's designed to allow individuals to experience their bereavement with a structured, supportive framework that explores grief, fosters emotional release, strengthens resilience, and cultivates a sense of connection with deceased loved ones through being outdoors in nature.
So this is in conjunction with IADC, or this is totally separate, or it sounds like the goal might be similar.
I can't say it's in conjunction with IADC because that would be taking away from the reliability and the validity of that protocol. They are pretty strong about how to do IADC, and I honor that. So no, this isn't about like IADC outside. That's not what I meant. What I meant though is that I have noticed that when I am working outside with people in general, though, they tend to just be more receptive to something spiritual happening. So it involves a few different things. There is a grief processing framework, which is a reflective protocol that lets clients explore their unresolved grief. I can't really get into all of it yet. There's also a spiritual integration where they're experiencing a connection with their deceased loved ones through a sense of belonging and being in nature. There's also a tea ceremony, which is where they have tea with me outside with plants that I foraged. I'm an herbalist. And it's meant to symbolize our connection with nature and how nature heals us. So I think I need to go back a little bit and explain what I'm talking about a bit more with this and why nature would be helpful in this. I've always seen it as nature is our greatest therapist. One of the reasons is that when people go outside, they feel better. And the reason why they feel better is that when they are under trees, they are receiving a compound called phytoncide. Phytoncide is a compound given off by trees that helps us increase our natural killer cells. So we really do physiologically feel better. Being outside also significantly decreases our cortisol levels, our depression, anxiety levels. And a study by Harvard Health, being outside can actually decrease pretty consistently, can actually decrease our need for antidepressants by over 30%. There's just a lot of reasons why being outside is very helpful. And if people want to learn more about that, they can go to the Association of Nature and Forest Therapy website. There's a bunch of papers that you can read about it. But when I do this with people, basically I lead people through these series of what I call immersions. That's me taking it from my training as a certified course therapy guide, which are really more like guided meditations. The ones I'm doing with the grief are ones I've been making myself that are more so grief oriented. As they're going through these meditations, and encourages them to have a sense of what's called bodyfulness, which is not, it's actually the opposite of mindfulness. It's actually about us getting out of our bodies and feeling like we're having a connection with nature and letting nature just give us what it has to offer. After they undergo all of this and they're doing all this processing and everything, then it closes up with this tea ceremony, which breaks out liminal sacred space, and they can just go back to their baseline and have discussion. The reason why I decided to do this is because when I've just done just some general forest therapy guiding with people, I've noticed that for many of them, they were having very profound experiences because they've been experiencing nature in a new way. There's been people I've seen who have touched a tree and really spent time with that tree. I mean, like really spent time with that tree, their hand on it, feeling its energy, feeling that electricity, imagining what that tree could tell them if it could speak to them, what that tree has witnessed.
So I need to ask. I need to ask. I'm sure there's people wondering. I mean, is there any psychedelics involved in this at
No,
all?
no,
Okay, okay,
no,
because
there's no.
that's the only time I've heard of really someone really getting into nature to that level is trying psychedelics. So go ahead. I'm curious more.
No, no, that was actually a good question, but no, but actually you bring up something important. I don't do therapy with people when if they're under the use of anything, except coffee. Coffee's fine, whatever. But when people are having this experience, it can allow them to feel this connection in a way they never did before. I've witnessed people straight up cry and thank a tree just because they approached the tree in a different way than they never did before. Because instead of seeing it as a tree, more so seeing it as a being that has a story and just having that curiosity with it.
I swear, I'm gonna probably sound like an idiot right now, but there was a time I was cutting my grass outside in the backyard, and I'm thinking, I'm literally lopping the heads off this grass, and I wonder if it's screaming out right now, at me, the whole ecosystem, whatever.
No, you don't sound crazy at all because really, yeah, that would affect the mycelium network, which is underground and everything, and it's
Yeah.
this whole fungal network that's kind of like the world's version of an internet.
I mean, I know that there's research on plants moving away from threats, and I mean, I've even heard of them saying that there's actually some sort of sounds involved too, but I'd hate to find out that turns out we've been inflicting pain on all these, you know, creatures.
And I think it's just one of those things of where all we can really do is just accept that and see it also as just part of the cycle. Because then we can go in this whole question about what constitutes pain, but that's a completely different subject. Yeah.
Right. Well, I mean, it wasn't until very recently they always said, you catch the fish and they don't feel any pain. You rip the hook out of their mouth, throw them back in. They don't care. There's nothing going on in their brain. And now all of a sudden they're going, oh, actually, yeah, they're feeling a lot of pain.
Yeah. Yeah. I mean, I'm a vegetarian, so I agree. It's more like I don't know what to make do with if my lettuce is in pain. I don't know what to do.
Well, I mean, we have to eat, right? So otherwise. Okay. One question I'm a little confused about. So we've got IADC
Mhm.
and then you've got ecotherapy and they're different. So how do you decide what someone's getting? Or how do we decide what path we're taking on that?
So it's really more so a matter of logistics and preference. Some people just don't really want to be outside or something like that, or wouldn't be conducive to them because the time they need to do some of this would be at nighttime when they have the availability. I want to backtrack a bit because I know I just got done earlier talking about how I work 9 to like 4:45. My exception is for when I do IADC. That I tend to actually advise that I do it in the late evening at like 9 o'clock because with it being an EMDR based therapy, people really do get very physically tired afterwards from it. So I tell them, you know what, this is something you want to do before you go to bed. That said, though, if people really do want to actually do something like this outside or whatever, I do allow them to meet with me in person, and we'll do it in the daytime, but that just means me blocking out my calendar for the rest of the day. As far as if people want to do IADC versus ecotherapy, the ecotherapy doesn't necessarily always have to be for grief. It can be for other things as well. I would say really it's more so just a matter of that sometimes it can be harder to do things outside. It can be weather dependent and all of those factors. And some people just don't really want to do outside. They really would prefer to be inside.
So I'm curious when you said with IADC, the person tends to get tired. And so you do it at the end of the night, and boom, then they go to sleep afterwards, I suppose. Is there grief that they're probably going to work out when they're asleep then?
Yes, that can happen. I do let them know that they may still continue processing while sleeping, but that's to be said about any type of EMDR therapy. If that happens, it is normal. If it continues to happen, they should let me know. They can follow up with me. To tell you the truth, it hasn't happened with me in IADC, but it has happened when I've done just standard EMDR with some people. It's rare, but it's happened. If it does happen, I actually have a protocol I can teach them, which is called the changed sleep protocol, changed dream protocol. Basically, it's a way of where I can have them rehearse a difference in their dreaming, and then they practice that throughout the day. So then that gets installed.
Okay. What's something about grief that most people don't understand?
There's no such thing in reality as the 5 stages of grief. It's a lie. And it's a gross misunderstanding. The 5 stages of grief was developed by a researcher named Elizabeth Kubler-Ross, who was actually trying to explain the stages of grief people go through if they are dying. It was developed for hospice patients. It was them working from this anger, this denial, this depression, this bargaining, blah, blah, all the way up to the acceptance of that they're going to die and there's nothing they can do about it. It was never meant to be for the people who lost the person. Because think about it. People don't really have a problem with accepting someone died. They know they died. They're trying to make sense of what to do after. So I wish people understood that grief is not like that. Also, I wish people understood that journeying through grief is not linear. I would say the best way to think of it is that it's more like a messy, weird web. Sometimes you're gonna feel okay, and then it gets weird and all disjointed again, and then you continue through. Grief ultimately isn't so much about working through it and getting over it. It's never about getting over it. It's about just learning to make sense of it and live your life despite that and continue to find meaning in it and grow from it. Because really, it's a normal thing. We're supposed to go through grief.
Okay. Let's talk about herbalism real quick. So you're into herbalism. There's something that it's connected. Do you have a certification for it? It's connected to a certification you have, or can you explain that?
Yeah, so it's not like a separate certification. It's that when I did my forest therapy training through the Association of Nature and Forest Therapy, it requires that alongside that you are learning some herbalism, which is taught in the course. It's not like super in-depth, deep herbalism, but what it is it does teach you how to identify very common plants that can be used outside, to know what's safe, what isn't safe, how to use them, how to make them into teas and so forth. From there, I kind of just took it into my own self-study. I love herbalism. Actually, I just made a salve made out of a jewelweed and broadleaf plantain, which are very, very common plants. And it's great because it's the best remedy for poison ivy, actually. Yeah. And I just keep that stuff on me. Yeah, yeah. So jewelweed is you've seen it before. It's also called touch me not. It has these beautiful little orange or yellow pods on it in September. It has a secretion inside of it that really is the natural antidote to poison ivy, and it usually grows around poison ivy too. It's wonderful. I've been out there before where I made contact with poison ivy, and I was like, "Oh, I'm gonna get a rash." I find some jewelry, put the sap on me, and it goes right away. So yeah, I make salves too to carry that on me because it's just a nice thing to have, and it's also really good for bugs.
Very cool. All right. Tell us about sugar maple counseling and ecotherapy. That's your business, right? Would you like to talk about what it is? What would you like people to know about it?
So people can find me at sugarmaplecounseling.com. That is one L, not two. If you put in two L's, it's going to send you to a website that for a practice in Ontario. To tell you the truth, I'm really not that active on social media. You can look me up on Instagram, but you're not going to see much. Same with Facebook and so forth. So, as I said already, I specialize in grief and complex trauma, also new motherhood and some adjustment issues. I am actually been kind of stepping out from doing so much therapy, and I'm trying to do more things like providing supervision to associate therapists and doing more speaking opportunities and things like that. And then that way I'm focusing really more so on IADC and EMDR and those things. But I am available, I am around, I am in network with most major insurances. For people who really would like some services as well, this can't be IADC because it does have to be through me, full disclosure. But if people want to reach out to me and they do not have insurance or they have an insurance that I do not accept, I actually am offering free therapy. The therapy is through my associate therapist. The payoff is basically you're helping them work towards licensure and everything and them gaining the experience they need because they are graduate level students. So they literally have to work for free. That's the thing that has to do with the social work board and everything, not me. So they're getting the hours, they're getting the direct experience, and people are getting services they need that they might otherwise go without. I'm
Awesome.
sure for a lot of people who've been listening, and they probably noticed that in particular, if they have a certain insurance, and I can't give names here, unfortunately, but if they have a certain insurance and they know that they have a really hard time finding care, and it's just because so many therapists are out of network. So I've really been trying hard to stop that cycle because I don't think it's fair that people can't get help.
Yeah. All right. All right, Valerie. That's it. Really appreciate you coming on.
Thank you. Thank you.
Yeah, definitely learned a lot.
Yeah. Yeah. You stopped recording, right?
Not yet.
Oh, okay. Well, I'm still recording. Okay.
That was Valerie Smith, a grief and trauma therapist with Induced After Death Communication. Thought it was fascinating. I'm glad she took time out of her day to talk to us about it. And if you have an interesting job like Valerie and you'd like to be on the show, then email me at talesfromtheshiftpodcast@gmail.com. I'll get you on the show. And if you enjoy this content, why not give a little like, a little subscribe, a little comment down below, click a video up top. I don't know. I'll talk to you later.